All right, 26 minutes before the top of the hour here on the program, Gauteng MEC for Health, Qedani Mahlangu, made a decision earlier this week to close the doors of the Life Healthcare Centre Esidimeni Rand West branch. The centre, which caters for people who are mentally ill and disabled, will be without services as of March next year. The hospital treated just over 2,000 patients who will be left homeless. This morning we chat to Cassey Chambers, Operations Director of SADAG, and Marion Conway, whose loved one is amongst those who will be discharged soon. Ladies, thank you for coming in. Thanks for talking to us this morning.
Morning.
What led to this decision? Do you know?
Well, we've heard different opinions. We've heard statements from the MEC that it's due to cost cutting. They cannot afford the 10,000 Rand per month to look after these patients in these hospitals, as well as looking at deinstitutionalizing patients back into society. And for us, it's quite concerning because the structures haven't been put in place just yet to provide, for these patients the minute that they come out.
Yeah. I mean, let's take it from a more personal perspective. What's going to happen to your who is being treated there? Just
My mother.
Your mother is being treated
Yes.
there. What's going to happen now?
I'm actually not sure because I've been asking the same questions. Where will she go? Unfortunately, she's treatment resistant, so she needs to be institutionalized in a place where they can be taken care of during the day and at night.
Okay.
So that's the biggest issue, and I've been asking questions from the MEC. What's going to happen with my mother? They haven't come back to me. They don't have answers at this point in time.
Yeah.
Where she'll go.
Yeah, which I mean is a huge problem. I mean, we've had conversations before where there's not enough treatment facilities as it is right now,
Yes.
and now closing one down that treats. What are we talking about 2,000 patients?
2,000 patients, and we've heard statements that patients will be reintegrated into NGOs or they can go to hospitals or facilities. They're already full. To try to find space is incredibly difficult. We find it difficult as the suicide centre. So where will these patients go? Here we've got Marion who's looking, for solutions and options. So many of these patients don't have families. They don't have options or even financial resources to pay for private care. These are also patients that are severely mentally ill, that have gone through systems like the hospitals, the Sterkfontein Westkoppies hospitals, and this is their last resort. So we're just concerned, and we want to work with the Department of Health. We want to say, what are the different solutions? How can we better support this to prevent more patients and families from feeling anxious and nervous and kind of stuck of where do we go from here?
Yeah, I mean, your mom is clearly lucky because she has family, she has
Yes.
somebody. But I'm sure there are a lot of patients that are in that facility that have got absolutely nobody.
Agreed. The other issue is my mother's been through the system. She's been through hospitals, she's been through TARA, she's been through NGOs. NGOs will not take her back because of her being treatment resistant, and she's delusional.
Yeah.
So that's a big problem, and I'm not one of them. It's the whole hospital that has patients very similar to my mother's condition.
Yeah. Have you actually been in touch with the Department of Health?
We have. We've sent letters, we've requested appointments, and we're trying to engage. This is the thing, as an advocacy group, we're representing patients and families. We want to work with them. If this decision is going to take place, how can we better support this? What needs to happen before these patients are discharged in March? We want to make sure that structure is in place so that these patients feel better supported. So we're hoping that we can engage. We're waiting for a reply, and we would like to meet to discuss this further before it becomes a crisis in March.
Yeah, because I mean, if you look at the situation, obviously a lot of these patients are on medication. They're getting the medication in the facility, and as soon as they leave the facility, that all comes to an end, I imagine. I mean, is that how it would work?
It would. Where would these patients go?
Yeah,
Already, medication for mental illness is not readily available in community clinics. There aren't psychiatric nurses at community clinics. There aren't enough NGOs that deal with mental illness in communities. So we're just worried once they get dispersed into their communities or sent back home, what support, what help is going to be available, and how will these patients who are severely mentally ill, they're very low functioning, how will they know where to go, what to do, and how to get help?
Yeah. Obviously, have you been since the announcement has been made? Have you been to the institution?
I have. We had a meeting with the family.
Yeah.
And the Life Care Hospital. Family was very irate. The families got very upset. Each of them went up with a mic and explained each problem that they had with their family members leaving this institution.
Yeah.
And everyone spoke about their problems. Families actually want to fight against this because they feel that the care that they get at Life is the best that they've ever gotten. for these patients.
Yeah. And the reason that the actual facility is giving for their closure, have they given a reason?
The facility, I don't think they'll be able to afford.
Okay.
So how will the patients be able to finance their family member in this place?
Yeah.
I know that the MEC has stated that they're ending the contract. So they're not closing the hospital themselves, but they're ending the contract. They were paying for these 2,000 plus patients to be there. So by them ending the contract, it means that this facility would be looking to close or provide private care, which most of these patients, majority, cannot afford.
Yeah. I mean, when we talk about private care, what's the amount that we're looking at?
It could be a couple, 10, 20, 30,000 rand a month.
Wow.
Yeah.
I mean,
No
can't.
average family can afford 25,000 to 30,000 rand a month.
Yeah. Which basically leaves the burden on you to perhaps take your mom in, but you don't have the ability to look after your mom.
I don't.
Yeah. So, I mean, where to from here? What happens? I know you've sent letters. I know that you're asking for more answers, the reasons, all of this stuff. But, where else can you assist? I mean, what happens now?
I mean, as an advocacy group, we have patients and families coming to us. What do we do? Where do we go? How do we get help? So we're obliged to help these people, every single day. What we're looking to do is to work with the NGOs, find out what are their problems, how they can help, what facilities they have. We're engaging with families. So we will literally be taking this week by week to see how we can assist further, and ideally even look at extending the closure in March, working with the different professionals and organizations. We just want to find solutions and really understand the issue, why it's happening, what plans are in place that maybe we're not aware of or hasn't been made public. We just want to find solutions.
I mean, what I'm reading is what they said is that they're going to be releasing those who are responding well to treatment first. Does that really make a difference at this point?
Well, is the support structures then in place? We know that some hospitals already have been closed and patients have been already discharged, and that's already happened.
Yeah.
Have the support structures already taken place? Have there been training? Has there been any kind of support that's been given to these patients? So we're having to look at the mental health situation in Gauteng and even in the country, because this may be a trickle-down effect. If this is happening now, what's going to happen to other patients? And I think it's just to relieve that anxiety. We want to be able to give answers and give proper solutions and direct people in the right direction.
Yeah.
But at the moment, we're kind of left in the dark.
Well, I mean, I think it just again throws the spotlight on how South Africans, let's take it to the upper levels of government, deals with people with these kind of illnesses. And it seems like this is not the way we should be dealing and handling the situation.
Definitely. There's a lot of stigma still around mental illness.
Yeah.
It's not a priority on most health budgets, on any, if it does make it. And for us, we need to make it a concerted effort to really help patients, because in March, when these patients are discharged, if anything had to happen or there is a crisis, how do we then deal with it? So we're trying to be proactive, we're trying to engage, and we're trying to find a solution before it becomes a bigger problem.
Yeah. Any final word from you, Marion?
I think discharging patients that have been at life hospitals, they will relapse. They're there for a reason. And within 6 months, they'll be back in the system. And again, NGOs will not take them once they've been there. And they're treatment resistant, which is a big problem. Discharging patients easily and quickly doesn't maintain them. In other words, they have to continue their medication. And the communities don't have that support structure in place. There's no psychiatrists available for these patients. They can't actually support the patient that's mentally ill in the community.
Well, listen, we're certainly not going to end this here. We'll definitely take this up and perhaps invite the MEC. She really is a very, she always avails herself to coming in and talking to us about it. The Gauteng MEC for Health, Qedani Mahlangu, hopefully we can get her in here and talk about this and talk to her about some of the concerns and find out why. But listen, thank you for talking. Thanks for raising the issue. Cassey Chambers, Operations Director at SADAG, and Marion Conway, whose mom is amongst those that are set to be discharged soon, well, in March next year, when Life closes its door. Life Healthcare Centre, Esidimeni Rand West branch that caters for about 2,000 mentally ill patients, and it's a big number, it really is. All right, the time's just before 9:45.